My name is Sara Langworthy, and I'm an extension educator with the Children, Youth, and Family Consortium. So the project that I'll be sharing about today is called the Child Welfare and Education Learning Community. This is a project that stemmed out of a relationship we had with a few other universities across the country. So the University of Chicago, Chapin Hall specifically, and then the Duke Center for Child and Family Policy. Some colleagues got together and wrote a grant to the W2 Grant Foundation to fund the work. And basically the goal of this learning community was to bring together researchers, professionals, and practitioners across those 3 states to talk about issues that surround the intersection of child welfare and education systems. One of the really interesting pieces about this project was that we engaged with people who were at the practice level, so people who were social workers and direct practice service professionals, as well as people who were working in state agencies. So this program is really focused on the policy level of the spectrum of prevention. I'll say that it works at several of the levels, but really the goal of the group was to gather and create some recommendations around policy, policy changes, and things that systems could do better to better support kids who are in child welfare, and especially with respect to academic success. I tend to think of policy pretty broadly, so in terms of a definition for what working at the policy level means to me, it doesn't necessarily just mean legislative policy, and it also doesn't necessarily just mean agency policy or organizational policy. It can and should mean all of those things. For the child welfare and education learning community, working at the policy level has really been centered around breaking down some of the barriers that exist between these 2 systems of education and child welfare. And we've done that through a series of conversations with policymakers, researchers, and professionals around what are the needs of children who are in child welfare, and what are the educational systems and structures that are in place to either support or hinder the success of children who are receiving child welfare services. I would say there are a lot of challenges in working at the policy level, but they're not necessarily unique challenges. I would say that the challenges you face at the policy level are similar to what you face at the other levels of the spectrum of prevention. Really, a lot of the work at this level is about relationship building. So, you're not going to enact policy change if you don't have connections and relationships to the people or the agencies or the groups that you need in order to make that change feasible. It's challenging because you come in with this idea of, like, we want to make this policy change because we want children in child welfare to have better education outcomes. So how do we make that happen? You begin to learn that it's really complex, and so it's not for lack of trying, and it's not for lack of wanting change to happen that these barriers exist in the first place. So I think you sort of have to check your frustration at the door sometimes too, and understand that building these relationships and having these conversations are really the foundational elements that are required in order to make sustainable policy change. I think the biggest challenge in evaluating at the policy level has to be around scope. The biggest challenge is figuring out how and if that is going to have any impact, any bigger impact than just, us and our friends reading this report. We're never going to know if somebody from Alaska takes our report and uses it to inform legislative policy that's done there. The advice I would give would be to just be open and to be able and willing and ready to learn. But I think just going into it with a heart toward building a relationship with anyone who wants to build a relationship with you. I think those are really important skills. And again, not unique to the policy level. Those skills are important and transferable across all levels of the spectrum of prevention.